Welcome back. Thanks so much for being here. Are you going to take part in this interview
I was
process
going
today?
to, but you just jumped right on in there.
We'd like to welcome... Oh, go ahead.
No, go ahead.
No, you go ahead.
No, you go first.
No, please do.
We have Erin Berry with us. She is the ER department manager. And you have been in this position how long?
For just about a year.
Okay, and how is it being the manager?
It's going great. I am really excited about a lot of the things that we've been doing and some of the changes we've been making in the emergency department and some of the new additions that we...
Now, you started before this new ER Express department came in, right?
Yes.
So,
yes.
I mean, you've got a little more on your plate now.
Yes, yes.
Scheduling and...
Yes, absolutely. Yeah. I am the emergency department director and was so for a few months before we implemented the ER Express.
I want to know what the ER Express is then.
The ER Express is actually an addition to the emergency department, including 4 additional rooms, additional staffing, and another provider for those minor emergencies that come in through the emergency department. Patients will still be entered in through the same triage process to determine that the correct patients are going to the correct places. But it's just an effort to help minimize wait times for those minor emergencies that could be taken care of outside of the main emergency department.
Exactly. Well, that sounds good because that's always an issue when you get a lot of people in the emergency room. There's a wait time.
And everyone has an emergency, don't they?
Yes.
And they think that their emergency is more important than someone else's, I'm sure.
Well, and it's difficult when you have something going on in your life or in your family's life, and to compare that to someone else's, you can't. So we just wanted to. There are different levels of care, critical care, and patients that aren't as critical. Everyone needs to be taken care of, but this was just a way that we found to be able to assist those patients that are not as critical quicker.
And this will all take place in the triage area, I guess, to decide who goes where?
Yes, to decide who goes where. So you'll still be entering the main emergency department entrance. You still will be interviewed and assessed by a triage nurse, and then they'll determine what level of care is appropriate for you.
Does this mean that people can feel more confident about coming to an ER for other things other than thinking that it's an emergency? Can they come for just about anything?
Absolutely. If you feel that you have a need that needs to be taken care of immediately, and then that's absolutely a true statement.
Yeah, I think a lot of people think, well, I can't go to the emergency room. I don't have a broken arm, or I'm not bleeding, or something like that. But there's other emergencies like bronchitis or flus and that kind of thing.
There are other issues that the quicker those illnesses can be determined and we can initiate treatment, the better off your end result can be.
And you've been open for how many months? 3-4 months now?
Yes, started in July.
Okay.
And all is going well in that.
Can you tell that the wait time is shorter?
Yes. We had, with any brand new implementation, you have kind of your slow initiation process. And that was July for us. We were building up, just trying to see what flow works the best. And now we've actually increased the number of patients that we've been seeing since July 1 to October 1 has increased by 15%. Yeah. Which is
that's a big
huge increase.
Yeah,
when you're talking about this, initiating a process in just a few months.
Right.
So.
What about the emergency room now? Is it more efficient, or is it, people stand around waiting for something to do, or?
Well, no, that
doesn't. I just threw that out there.
Gosh,
I wish people would come in. There's no business for us. They're all on the ER
Let's see,
Express.
we haven't had. No. What happens is it takes the patient load that we were seeing before, and by filtering out those 2 different levels, the nurses working in the main emergency department are able to be more efficient in their
better care.
Yes, it improves the quality and the safety of patient care enormously just by having those 2 entities. So
for people out there, they should feel comfortable about coming into an ER setting, no matter what kind of
Absolutely,
situation they're
absolutely.
into.
We are taking steps not only with ER Express, but we've added an ED frontline person. So
Which is what?
which is when it's during our highest volume times. We've added a clinical person with clinical knowledge and training to stand out front in that main area, window area, as patients come in, to identify those who may not be able to help themselves but need to be taken back immediately.
So is that pre-triage?
In a
similar?
way,
Yeah.
yes. It's very similar. They are during our highest volume times, it's not a 24/7 position
Okay.
at this point, but during our highest volume times, they are that person to identify those who may need quicker assessment than others. So
What are your highest volume times? I mean, you mentioned highest volume times, so how does that
currently
run?
we're tracking over the last 3 months, currently about from 3 p.m. to 10 p.m. is our highest volume time, with give or take on a few days. ER is a feast or famine type area.
Exactly.
So we may see 75 patients a day, but we may have seen the bulk of our patients in a 4-hour period. So that determines a lot
And
of
certainly with
staffing and
doing
everything.
that, well, I mean, I've been in there with my mom before, and thank goodness she has a family member that can sit with her. But,
Yes.
when you run your nurses in several rooms, it's hard to get that consistency sometimes.
Absolutely, and
So-
that's what we're trying to work on and focus on. Our number one focus is quality and safety in patient care, and that's where we have determined that things like adding ER Express and the ED Frontline are not optional. This is something that we have got to do for our patients and for our community. And we've had several new additions in the ER. We've become part of the AR Safe Stroke program, and we are in pursuit of a level 3 trauma designation. And those are all things that are going to focus on our patient and the quality of care that the patient receives when they come in our hospital doors. So,
Wonderful.
All good, great new things coming up.
yeah.
And we just want to express to people out there that you don't have to do anything different. Just
No.
Show up.
come in and show up. If you need,
Yes.
if it's an extreme emergency where you can't get to the hospital, dial 911 and make sure that
Absolutely.
the ambulance service comes to your house, and
Yes.
then they will make that decision when they get there, whether you go to ER Express. Same kind of care. It's just you're trying
Yes.
to make it more efficient.
It's the same. The nurses in both departments and the staff in both departments have been trained exactly the same. You're not receiving a lower level of care from
Or lesser
those.
care, yeah.
Yeah. It's just determining, and like you said, you don't have to do anything different.
Yeah.
You come in and we'll take care of that part for you. So.
Erin, thanks so much
Thank
for being
you.
here.
Thank you.
And we welcome you to come back again and tell us
Okay,
how it's
well,
going.
Thank you for having me.
And
Yeah,
you can-
another update, maybe, a little further down
Yes,
the road.
absolutely. I can
Yeah.
do that.
And bring your wedding pictures next time.
Oh, okay.
Or your honeymoon pictures,
Yes,
yeah.
maybe I'll have those together.
You
by
made her
then.
turn red. I don't know why. Yeah,
Thanks
you're
a lot
turning
for being
red.
here. I know.
Thank you.
All right, thanks a lot, Erin.
Thank you.
Up next, we're going to talk with Roz Slavic, and she's from the Boone County Historical Museum, and they've got a fundraiser coming up. We'll find out all about that, right? Yeah. In just a minute or two. Stay with us.